There are various parameters which affects the dissolution and the drug release. In the dissolution testing, many of the parameters and factors are there which are required to be considered and which are required to be studied in detail to understand effect of each parameter onto the dissolution and the drug release. In this video, we are going to learn regarding the parameters of the dissolution media which affects the dissolution. So media related factors we will see. I welcome all the viewers to this informative video. This will be a short video and will cover all the parameters related to the dissolution media. So whenever we are selecting the dissolution media for the dissolution testing, we should consider many factors. The dissolution media should provide the consistent drug release among all the batches. It should provide sink condition. It should be easy to prepare and it should give the release profile. Whenever you are working onto the dissolution, always consider that in the research phase, the dissolution parameters are developed, dissolution method is developed, and then it is transferred to the manufacturing site where the batch is released based on the dissolution testing. Let's start with the overview of key parameters affecting the dissolution. First is the pH of the media, second is sink conditions, third one is surfactants, fourth one is temperature, then ionic strength, dissolved gases, hydrodynamics of the media, enzymes, and media volume and the dissolution apparatus. So altogether these factors are very critical for the dissolution and the drug release. As we know that pH has a great impact onto the dissolution, solubility of the drug. Drug solubility is pH dependent for weak acids and bases. So pH is required to be studied in detail. Different pH of the media can affect dissolution. In some of the medias, you can find that the drug get released easily, while in some of the media it is not released or it is not solubilized. Sometimes precipitation may also happen. pH solubility profiles identifies the optimal medium. So whenever you are finalizing the dissolution media, that time the dissolution media pH is very important. The buffer selection should be such that it ensures stable pH during testing. Then sink conditions. So the media pH, media volume should be able to provide the sink conditions. Drug concentration of less than 10% up to 30% of solubility limit should be there. Or you can say that the media should be able to dissolve the 3 times of the highest dose strength of the product. Sink conditions are required to maintain the constant concentration gradient and it should mimic the GI tract. It is critical for consistent drug release, bioavailability, and therapeutic efficacy. Another parameter is surfactant. So whenever there is a low solubility of the API in the media, that time surfactants are used to enhance the solubility of the poorly soluble drugs. Various types of surfactants can be used at different concentrations. Surfactants are used when sink conditions aren't achievable by aqueous buffers alone. Common surfactants are sodium lauryl sulfate and polysorbates. Then temperature. Temperature of the media also affects the drug release. The body temperature is simulated like 37 degrees Celsius. Temperature affects the solubility, diffusion rate, and the drug stability. Temperature also affects the API crystalline form, API amorphous forms differently. Temperature also impacts solubility of some of the excipients. Ionic strength. Ionic strength means it is the total ion concentration in the media. Ionic strength is required to be maintained and studied as it can mimic the physiological ionic environment. Generally, sodium chloride, potassium chlorides are used. Moderate ionic strength can provide the enhanced solubility, while high ionic strength may reduce it. There may be observation of the salting out effect. Then another factor is dissolved gases. So if the media contain the dissolved gases, air bubbles, these can cause floating, sticking and variable hydrodynamics. Degassing is done to prevent the pH shift and the bubbles. Degassing can be done by heating, filtration and sonication. Critical for the reproducibility and accuracy. So whenever you are working onto a dissolution media, check whether degassing is required or not. Also, you can perform dissolution with degas media and without degassing. Then hydrodynamics. So media should be agitated in the apparatus. Fluid flow and agitation has a great impact onto the dissolution. If you are using basket apparatus or paddle apparatus, then the speed of basket or the speed of paddle can affect the hydrodynamics, and hydrodynamics can affect the dissolution. You might have observed coning at low RPM in the paddle apparatus. Proper mixing and proper hydrodynamics ensures uniform dispersion and measurement accuracy. Another factor is the viscosity. So if media is viscous or if the media viscosity is increased, it can slow down the diffusion and the drug release. So consistent viscosity is needed, especially for the polymer containing formulations. Then another factor is media volume and the dissolution apparatus. The media volume affects the sink condition and hydrodynamics. If your formulation is containing the highly soluble drug substance, that time the media volume may not have much impact, but if the formulation is containing insoluble API, that time media volume will play a great role. Apparatus choice depends on fluid flow, mixing and contact time. Must be suitable for the formulation type like tablet, capsule or suspensions. Media volume typically 500 ml, 900 ml or 1000 ml is considered for the dissolution testing. Then enzyme use. If you are developing a biorelevant media or you are working onto a capsule formulation which is undergoing or may undergo cross-linking, that time enzymes are used. Enzymes can simulate GI tract degradation, GI tract fluid. So pepsin and pancreatin are the enzymes used. These enzymes are important for gelatin capsules and lipid-based formulations. So it requires compatibility checks with the surfactants and the excipients. Optimizing the dissolution media parameters, ensure the robust and discriminatory dissolution methods, provides the consistent dissolution results, predictive for in vivo drug release behavior, and these are important and critical for regulatory compliance and the therapeutic success. These are the points to be considered for dissolution media parameters affecting the drug release. Thank you for watching the video.